Now Kenya has joined the rest of the global community in the marking of the 10th anniversary of World Cancer Day. This year's theme is We Can and I Can, and the aim is to prove that every single person can make a difference in the fight against cancer. Our senior reporter Carol Nderi will be joining us shortly from Nyeri, where the national event is actually taking place now. Now, breast cancer has largely been associated with women, and according to the health experts, very few men go for checkups, even when the symptoms of the disease are at an advanced stage. So, as the world commemorates the World Cancer Day today, KTN's Murimi Mwangi spoke to a colleague journalist diagnosed with breast cancer.
For a budding scribe who earns his daily bread telling stories, some very emotional about people, 31-year-old John Karume, a correspondent for the Standard newspaper based in Kiambu, probably felt that there was no cause for alarm, or simply nothing to write home about a small lump that was swelling by day in his chest. After all, it was just a swelling, causing no pain at all. And so he went about his daily duties unperturbed, that until he noticed that the lump was swelling towards his armpit. It would only dawn on him months later that he had just become the latest breast cancer patient.
Waited for 7 working days, upon which on December 4th, Dr. Githaiga revealed to me that whatever they had been investigating has been confirmed that I'm suffering from breast cancer. And by the time they were realizing, I had been suffering from the disease for 7 months.
Karume is one in the growing statistics of men increasingly being diagnosed with breast cancer. And as the global community prepares to commemorate the World Cancer Day on Thursday, health experts have now raised their alarm over the disease which they say most men are ignorant about.
The thing about men is that they have very small breast tissue. They are not like women. So the first and the commonest presentation of breast cancer is a lump, a painless lump usually, that will be found behind the nipple or within the breast tissue. If you find a lump, you should be able to rush to the doctor or whoever the medical person to seek medical advice. In other words, men should also be doing what we call self-breast examination every month, so that if they find a lump which is likely to be painless, they should worry about it and go to see the doctor to help them sort out what exactly. It may not be cancer, but it's good to know.
Early signs of breast cancer include swelling on the breast, nipple pain or the nipple turning inwards, redness or thickening of the nipple or the breast skin, while some men experience discharge from the nipple, at times painless, a symptom which consultant breast surgeon Professor Ronald Wasike says is very common among patients, yet very few of them go for checkup even at the advanced stages of the symptoms.
Going to the hospital and being diagnosed with early breast cancer early or being detected by screening is very, very important, because it gives you a chance not only to live or to have an overall survival of about 100% or 95%, but also gives you a chance to save the organ that's affected, in this case the breast. So that's why it's very important for us to tell the public that they should go for screening, because by the time you are feeling a lump, you already have the cancer. We want to.
Wasika says 1 in every 100 cases of breast cancer is reported in men, and in most cases genetics plays a great role in its prevalence, hence the need for regular checkup.
But the breast cancer gene 1 and 2, if they are mutated, then they affect the breast tissue in terms of development and growth, so that these people have those mutations of BRCA gene or breast cancer gene 1 and 2, they have up to 85% chance in their lifetime of developing breast cancer.
Karume has so far gone for 2 chemotherapy sessions and still has some 4 more sessions to go. An expensive affair that has seen his colleagues in the media open a paybill number in an attempt to get him the necessary financial aid.
Per session, every day that I'm going for my chemo, the whole amount that I use amount to about 25,000, and I do this after every 3 weeks.
Message from the practitioners is that you need not wait for that swelling on the breast or for that painless discharge from the nipple to make that call to the doctor, and that with a monthly self-breast examination, then you can keep cancer and such radiotherapy sessions at bay. Murimi, Mwangi, KTN News in Nairobi.